Organism that gets around the roots of hairs and gives you pimples. If the razor has scraped a little of the skin off the cheek and there is a break in the skin, then you might get razor burn and again staphylococcus, or you might get some more rare infection with impetigo or something like that. This is the organism that can very frequently give you food poisoning. Remembering that one tiny little germ like that I have drawn and multiply in 24 hours to many, many hundreds of thousands, each one of them. And the most dangerous food of all is a food that contains nitrogen. Any food that contains nitrogen is a food at risk. The reason being that the staphylococcus, and in fact all cells, must have nitrogen in order to grow and to divide, because they are basically protein in their nuclear structure. And so any foods with nitrogen in, and by that I mean meats and fish especially, these are foods at risk. One has to be very, very careful where you eat and know that the kitchens there are properly tended to. The health inspector in most countries is allowed to walk into a kitchen at any time. So are you. Occasionally you should do, especially in some of these foreign restaurants. I no longer eat in Chinese restaurants under any circumstances. And you have to be careful. The trouble is that the food must be absolutely fresh if it has nitrogen in it, or it must be cooked and eaten almost immediately. If it lies around cooked or uncooked for a day and a half, one germ can already have become hundreds of thousands. Staphylococcal food poisoning is something that acts very quickly. It comes on, the effects of it comes on within 24 hours. Headache, thundering headache, nausea, just general malaise, feeling off color, maybe pain in the tummy, maybe a little diarrhea, and it must all be gone in 2 days, 2 or 3 days, and that's staphylococcus. If it lasts longer than that, then it can be something more serious. If it comes on very suddenly and is very violent, again, that is something more serious. There are organisms which are called, for instance, salmonella. I'm not dealing with tonight salmonella, where the food poisoning can be extremely serious. But the one to watch out for in general is staphylococcal food poisoning. Causes boils as well, boils, pimples, and quite often throat infections. But the real throat infection, and the real dangerous one, we usually end up living with our staphylococci. They usually adjust themselves to us. The really dangerous one is the group of cocci that form chains. And these are called streptococci. S-T-R-E-P-T-O-C-O-C-C-I. Streptococci. Strings of cocci. And these are dangerous devils. They cause a very, very virulent sort of sore throat that can be passed on from person to person. And if somebody in the household has always got a sore throat, then have the whole household examined to see if they are streptococcal carriers. They carry streptococcus in their throat and pass it on. It gives very sore throats, red inflamed throats, hot burning, and so on. They're also the organism that cause blood poisoning frequently. If the streptococcus gets into a cut, you frequently see from the cut on the hand long lines of red markings going up the arm. Those are lymphatics. Remember we talked about the lymphatic system on the first night and how the lymphatics drain the materials away from the body fluids up towards lymph nodes. Wherever there is a crease in the body, there is a lymph node. And streptococcus causes lines to be seen, red lines moving up, and that's dangerous, extremely dangerous. It's an indication that the body's defenses are being overwhelmed, especially in children, and once they get into the blood system, then you've got septicemia. Then we have the other coccus, which concerns us. We'll deal with it when I've done the regenerative systems, which I intend to do tomorrow night, and I'll talk about venereal disease. The coccus in that case is known as gonococcus, and it contains two kidney-shaped little, I'll draw a big one, two kidney-shaped sort of nuclei, something like that, gonococcus. The gonococcus is a very sensitive organism. It dies very quick if it's in any dried material or exposed to the drying effects of the atmosphere. Gonococcus must be in moist material, and therefore it is generally passed from person to person through contact, usually sexual. And the contact leads to the disease gonorrhea, and therefore certain parts of the body are more sensitive to gonorrhea than any others. The wet surfaces of the sexual organs and the eyes in particular, gonorrhea infections. So these are the cocci, and then the next shape that we want to deal with, the next shape we want to deal with is the rod-shaped organisms, and these are called bacilli. I don't know if I'm spelling well tonight. Bacilli, rod-shaped bacteria. They are responsible for tuberculosis, and several other conditions. Tuberculosis is a condition which develops when a person is in low health, when they can be suffering from malnutrition, overcrowding, overwork, lack of sunlight, all the conditions that arise when a family is crowded and under stress and undernourished and in damp circumstances and so on. The bacillus is something that can be passed on in the atmosphere. A person coughs in your face, and tramp on the street or somebody in a bus or whatever it is coughs in your face, you inhale the bacilli, and remembering that the surface of the lungs is about the size of the room, there's a possibility that somewhere on the surface of the lungs there is a weak spot, a dry spot, an inflamed spot, a broken place on that huge area, and the bacilli have only got to land there and they can infect the lung regions. The effect of the bacillus is to produce a cheesy material which slowly fills the lungs, and producing what we call consolidation of the lungs. And the lungs, instead of being airy bags, now slowly fill with a solid cheese-like material and become unable to evacuate them. Whereas you well know that penicillin is the excellent antibiotic for things like staphylococcus, there is now a cure for tuberculosis, unless it has become very, very much advanced. And tuberculosis can attack any part of the body, but particularly the lungs, the kidneys, bones, the spine, and so on. And there is a cure for it. I think the cure is a combination of antibiotics and chemicals. I'll tell you what they are, but they need not mean anything to you. Para-aminosalicylic acid combined with isoniazid and streptomycin. There you are. You've got some gorgeous long words there that you can practice on each other. These three materials in combination usually knock out the tuberculosis. It's interesting that the Tibetan master said that tuberculosis is a fifth root race disease, a comparative latecomer to the planet. It has developed mainly karmically through man's greediness, his concern with materialist things, and his enmeshment in matter is so to such an extent that his ability to take in the free atmosphere karmically is taken away from him because he is so consolidated. Well, that's the karmic side of it. Just remember, it is one of the major diseases, the three major diseases being the tuberculosis group. I'm speaking esoterically now. The tuberculosis group, which is related to the throat chakra. It is a disease of the fifth root race where the excess is materialism. The other group of planetary diseases is the cancer group of diseases. They are related to the solar plexus chakra, to the fourth root race, to Atlantis. And the stimulus for the production of this planetary disorder is, in fact, the emotional, trying to think of the opposite of license, emotional rampage, people who are emotionally rampant and unable to express themselves adequately any other way. It is a disease which, as I say, is related to the solar plexus center and related to inability to express the person's self, usually linked somehow to a sexual problem. The third group of disorders, which are of a planetary nature and related to excesses of root races, is the first one that appeared on the planet, the syphilitic group of diseases. And they are of Lemurian origin. They are related to the sacral center, the inability of, the excessive expression of sacral energies, and the syphilitic group of diseases include not only syphilis, not only the venereal diseases of gonorrhea, but they also include elephantitis and diseases which are concerned with the spirket, which is a third bacteria that I'm describing here. It is an organism that is a spiral-shaped cell, and sleeping sickness, and also it is related, strangely enough, to arthritis. The degenerative arthritis rather than the inflammatory arthritis, the osteoarthritis rather than the rheumatoid arthritis. Now, that does not mean to say that because many of us have Lemurian stock or Atlantean stock in us, that we're necessarily going to suffer or die from cancer or the syphilitic group of diseases. Nevertheless, the potential is there. The third root race, the sacral center, and very, very frequently this link with the third root race, the third ray, will show in women as dysmenorrhea in early life, menorrhagia, disorders of bleeding with regard to menstruation, and in the more adult woman in middle age, it can indicate gynecological disorders with the possibility of hysterectomy. And I have dealt with this in my book, Esoteric Healing, and also in Esoteric Psychology, where ray types tend to have tendencies towards these different three groups of diseases. Now, that is all you really need to know in this course anyway about simple bacteria and how they are dealt with. The nervous system. It's obviously not a subject that we can go into in immense detail, but we should learn something about it and see what esoteric factors can be derived from it. We have considered many kinds of cells. Blood cells, we have talked about epithelial cells of the skin, pavement-like cells. We have talked about liver, kidney, muscle cells, all sorts of cells. When we're talking about the nervous system, we're talking about a group of cells which are called neurons. Neurons. And the typical neuron is a cell which has got characteristic processes to it. It begins with a group of dendrites, and these fiber-like endings are joined together in the cell body. The cell body, which has got a nucleus, and then from it there emerges a long process known as an axon, and again the axon ends in processes like the nerve began. Now that's a typical unit of the nervous system. The nervous system is the mechanism in the body whereby control is and coordination is obtained and maintained with rapidity. The quick control of the body is through the nervous system. The slower control of the body is through the endocrine system. Endocrine glands secreting their hormones, always secreting them into the blood. The rapid control is through the nervous system, and you would expect it, therefore, to be an electrical phenomenon, and indeed it is. So we have got in the human body methods for controlling the various parts. And we tend to talk about nerves that take information to the brain, and these are sensory nerves, and we have nerves that cause activity in the body of various parts, and these are motor nerves. And so somewhere or the other we have got a coordinating center, which we tend to call the brain, and the brain may, through the use of nerves, send out instructions to move a part, or it may receive information about the environment, or the two may be combined together. If we take, for instance, a finger which is touching a red-hot piece of material, then the first thing that happens is that from a sense organ in the surface of the skin, there is a sensory nerve that has got a nerve body on it, like that, and an end process to it, an axon and an end process. And that would carry information into the body, into the central nervous system. The next thing that would happen would be an attempt by the body to remove the finger, and so an impulse would go to a muscle in the region of the finger, and the finger would be pulled away. And that might take half a second. It would be a very slow-thinking person to leave his finger on a hot iron for half a second. Would probably do it and pull it away in less than a quarter of a second, but not much less than that. And so we have two kinds of nerves: the sensory nerve, which feels the heat through a little heat organism, sensing organism in the skin, and we have another nerve that pulls the finger away. And they are linked together by what we call a connecting nerve, and there it is, like that. So we have a relay of three nerves there: a motor nerve, a sensory nerve, and an interconnecting nerve. Sensory, interconnecting motor. And the three together form a pathway of what we call a reflex. A reflex. A reflex. The typical example of a reflex is when you sit and present your knee for tapping, and the doctor taps the knee just below the patella, and you lash out with your foot. He has touched a sensitive part to your knee, and you jerk your knee forward. It's called the knee-jerk reflex. In fact, the purpose of that reflex, tapping the knee, let's put it down here, here's the knee like that. The tapping of the knee just there is to test whether a certain vertebrae in the spine with its nerve is patent. And so the doctors will go through a whole system of checking you out if you have a nervous disorder. If they suspect that there's something wrong with your nervous system or even the brain, they will do little tests on you. And the knee jerk will test the patency of a certain part of the spinal cord. And they'll say, knee jerk's good, that part of the spine's all right. They might stroke the bottom of the foot, and if the foot arches like that, then another part of the spine is found to be okay. And so they can check the whole spinal system of nerves in this way, testing your reflexes, it is called. Now, we can go a little further, and we can say then that there is a brain, which is a huge ganglion of nerves, and a ganglion is a grouping of nerves. In fact, the nerve bodies are mainly grouped in the brain. And then we have a spinal cord, like that. We have the peripheral nerves that come from the spinal cord, and that represents a single nervous system, the brain and spinal cord and the peripheral nerves. And we call this the central nervous system. This is the central, the brain and spinal cord is the central nervous system. This is the peripheral nervous system, that's part of it. In a little while we'll talk about the sympathetic nervous system and parasympathetic and see where that fits in. Now, what is the brain and spinal cord? It's really just a tube with a canal in it. Just a tube with a canal in it. But in embryo, as the child begins to form, this part of the tube begins to swell. One end of it begins to swell, and the tube swells out in that direction, and we get the formation of the great cerebral hemispheres and the development of a brain. Now, when we cut the spinal cord across like that, we find that there is a tiny little canal in the middle, and then there is a gray part and a white part. The gray part is in the middle of the cord, and it looks something like that, like two pairs of brackets facing each other. We call that the gray part of the gray matter of the spinal cord, and we talk about the white matter of the spinal cord, which is on the outside. Now, what is the difference between white and gray matter, whether we're talking about the brain or the spinal cord? Well, we can immediately say what it is from this nerve process. Let me put it back again. There's the nerve process. The gray part contains the cell bodies. The gray part contains the cell bodies, and the white part contains the nerve processes, the long nerve processes. Now remember that a nerve can be 3 feet long, and the general pathway of a nerve in the body is usually 3 nerves linked together. So if we take a foot, there's a foot like that, a foot like that, and the leg. There is a nerve that reaches, say, as far as the big toe and goes up all the way into the spinal cord, and that's one nerve. There's the spinal cord. One nerve. You must realize how vulnerable nerves are. Terribly vulnerable. Easily damaged. Easily poorly fed, if you like. They can be deprived of nutrition. And so there is one nerve there. Then the spinal cord takes the nerve up to the brain, and the nerve process would lie in the white column. There's tiny little nerves running up to the brain. The nerve process is the white part of the spinal cord. And then when the brain is reached, a nerve is a third process, and that completes the whole thing. So looking at me, as I haven't got unlimited, well, let's do it here. It's important enough to do it. There's the head, or containing the brain. There's the spinal cord, and there is the leg. Okay? Now we can put it in. There is a nerve that goes all the way up to the spinal cord, and let's say it's the sciatic nerve, which is the largest nerve in the body, the sciatic nerve. The sciatic nerve is broken into three parts. One part goes up as far as the spinal cord, another one goes up to the brain, and a last one goes to the surface of the brain. So there's 1, 2, 3, the sciatic nerve. And this nerve would move the little toe, or move the ankle, or any part of the leg. It is a huge nerve. So what we're dealing with then is a nerve pathway like that, 3 parts and 3 nerves. Now, the nerves link with each other at these places here, and we call that part of the nerve where two join each other a synapse. They don't actually touch. What happens is that the nerve endings secrete a chemical, acetylcholine, and the electrical impulse that flashes along the nerve jumps across the synapse and goes to the next one. And so we may get disorders in which the chemicals at the synapse are not forming properly, or forming too quickly. A nerve gas, for instance, such as been fashioned by the major powers, is a gas that affects the material, the chemicals at the nerve endings. And if a nerve gas is inhaled, it means the whole body starts to get out of control. The nerve endings are flooded with material, excessive material there, and all sorts of incoordinated movements occur, and the person becomes absolutely unable to control himself. Now, we have therefore nerve endings where there are secretions of material, and it would be there and there. And those are called synapses, not actual joins in the nerves, but spaces between them. So this is what we call then a nerve process. Now, in the surface of the brain, we have the origin of all these nerves. The surface of the brain, we have the origin of all these nerves. Now, what is the brain then? The brain is a place where all these nerves are assembled. It's a great ganglion, and they're sorted out. The information is sorted out there. And one would have to speak for hours and hours and many weeks to describe the many functions of the brain. What we need to do here is to sort out some aspects of the brain that are important to us in esoteric healing. And if we looked at the brain, we'll find that it is thrown into many folds, which we call sulci and gyri. The surface area of the brain is large, very large. It is contorted, folded inwards, and it really represents a sort of a map. It's really a sort of map. And every nerve that finds itself in the skin of the body or going to a muscle in the body must have a place on the surface of the brain. You understand that? And so the one that we've just been looking at, the sciatic nerve to the big toe, will have a place on the brain just there. That would be the big toe. This might be the arm here, and muscles of the neck there, muscles of the feet there, whatever it is. And so the whole of the body is mapped out. We're talking about the parts of the body that move. And this is known as the precentral gyrus. Last night, you remember, I gave you the esoteric aspect of it being related to Rome, where the brain was regarded as the ancient world. Now, it means then that every nerve that moves your body, any part of your body, is on this map in the brain. You could take the map out like that, if you like, and you could say that area shows what parts of the body can be moved. This area here shows us the parts of the body which have got skin sensory organs. And so we have another part of the brain that receives impulses from the skin. Impulses from the skin. Every part of the skin of the body is plotted out on this part of the brain, known as the post-central gyrus. The post-central gyrus. So we talk about this region of the brain for feeling, that's for motor, this is for hearing, this is for seeing, this is the higher center of consciousness, this is for speech, and so on. The whole of the surface of the brain is marked out, as it were, imaginary markings, of course, but indicate areas related to activities. Many parts of the brain surface we know nothing about. We only know that if a man smells something, then this part, partially hidden here, is a region that registers the smell. And immediately there are other parts all around it which associate the smell with something. Oh, a smell of frying fish. And therefore a whole area is needed for associations of smell. A whole area is needed for association of sight. If you see something red in the distance, is it a pillar box? Is it a flower? Whatever it is, association of ideas. So the whole surface of the brain is marked out in related areas. Now we can begin to understand what happens in a stroke. In a stroke, let us assume that a person has a stroke, and I think we've got to go over here where we can discriminate the different regions in color. Here is your brain. Here is the precentral area, which is related to the way in which we move the body. And from there we saw that from the leg there was a nerve that came down to the root of the brain, and there picked up with another process and went all the way down the spine, and then another process came out to the leg, like that. If you have something go wrong with the blood supply to this area, and a blood vessel bursts, or a clot forms in it, or it goes into spasm, even temporarily, closes slightly temporarily, then it means that the whole area around here may die. It may die. There is damage to the area, or maybe other blood vessels will take it over later. Blood vessels that are nearby may pour more blood to it than that region than they would normally. And so when a stroke occurs, it means that a part of the body can no longer be moved. And as these nerves cross over from right to left, it means that damage to that part of the left hemisphere may paralyze the leg on the right side, the left hemisphere, the right leg, or vice versa. So the therapy then is to try and get the patient to move his legs, to support him in whatever way possible, to encourage him to try and get the limb to move, hoping that if a blood vessel has gone into spasm, it will relax and allow blood through, or other blood vessels will take the area over and begin to feed them with oxygen so that the limb can again be moved. This is a region where a person can heal, and the placing of the hands opposite these gyri that I have just described, or just about there, brings the chakras in the palms of the hands close to this area. And of course, if you know your brain anatomy, and you can get it quite easily from a book in this respect, you can locate within half an inch the region which is producing this stroke, this paralysis. It may be that you will use various methods of applying energy to that area. Instead of just visualizing the brain, you can visualize a specific part of the surface of the head, overlying the region that has a poor blood supply. And so it's quite important to know something about this. Now, the nerves have got electrical properties which enable them to transmit information or to move a limb. The nerves are wrapped around, in many instances, by a fatty material. They're wrapped around by a fatty material called a myelin sheath. And this sheath is very much like the rubber that wraps around a piece of electrical wire. It keeps the electrical information insulated and stops it being wasted. It protects the nerve, it feeds the nerve, and it's very important. One of the best examples of this is the many nerves that make up the nerves to the eye, the optic nerve. And the optic nerve can be seen. If you flash the necessary instrument through the pupil of the eye, you can examine the optic nerve. And the optic nerve is very white because of this fatty material wrapping around the various nerve processes. The importance to us here is that certain individuals may suffer demyelinating disorders. By that we mean that the material, the fatty material around the nerves becomes disintegrated. It breaks up. And the best example of this is, I suppose, multiple sclerosis. Multiple sclerosis. And where you have a person suffering from multiple sclerosis, their nerves to certain regions become inefficient. The myelination is lost. It's as if the insulating material has been stripped off the wires and the electrical effects are dissipated. And so the first symptoms of multiple sclerosis may be such things as dropping plates. They every now and again drop a plate. They notice that they're dropping things like they didn't do before. And that would make you prick up your attention to consider whether there is a multiple sclerosis developing here. They very frequently are unable to terminate urination, and they are incontinent. They sometimes have double vision, and that is when the optic nerve is becoming demyelinated. They have double vision, and it is a process which comes and goes. It has exacerbations and gets worse, and then it has remissions and does much better. But generally speaking, there is a progressive deterioration. Another characteristic of the people is that they tend to be euphoric, quite happy with their condition, often laughing and joking when you think they've got nothing at all to be hilarious about at all. Now, the treatment for it, well, there's not much can be done. We've gone through all sorts of phases in the treatment of multiple sclerosis, such as vitamins. I think vitamin C was something that was given some time ago, and it may even be given today. I asked the Tibetan once how to deal with this, what the cure for it was, and he gave me a vision of a flower, and I could draw it and paint it exactly, even to this day, a sort of violet-colored flower, and it is a flower that grows in mountainous regions, probably in the Himalayas or in the Alps. I know I searched for many months trying to find an example of it and could not. It looks as if it is a deficiency disorder, something to do with deficiency in nutrition or inability to use the materials that are eaten, assimilate them. And we have treated this condition with biomagnetism and have had good results in some and no results at all in others. So nothing is proved by those experiments. What to do about it? Well, again, this is a condition where the assistance of the esoteric healer is tremendously important, that they can discuss not the illness so much with the individual, but the possible karma of it and how to bear it. And these people are often very lonely and need help and sustenance in that respect. We'll talk about it a little later on when we go into magnetism. So this is one of the demyelinating disorders. Now, the other aspect of the nervous system, we'll be talking about nerves again in a moment. The other aspect of the nervous system that we need to consider is just what is meant by the sympathetic nervous system. We have talked about the central nervous system, and when we talk about the sympathetic, we're talking about a nervous system that takes over the running of those parts of the body that have sunk below the level of consciousness. We're talking about a nervous system that moves the intestines while we're asleep. We're talking about a nervous system that activates the heart when we don't even notice it, and performs all the necessary functions that have sunk below the level of consciousness. We would live in a terrifying world if we had to remember that we should blink every 5 seconds, that we had to move our bowels, all 23 feet of them, regularly once every 30 seconds, that we had to retain hold of our bladders, that we had to hold our anal sphincters. If we had to do all these things consciously, we would have no time for anything else. And so they are controlled by a whole system called the sympathetic nervous system. Now, from the esoteric point of view, the sympathetic nervous system retains man's hold of waking consciousness. And the whole system is calculated to keep man in the world. That system, the sympathetic nervous system, is opposed by the parasympathetic nervous system. The sympathetic nervous system makes the heart beat faster. The parasympathetic nervous system makes the heart beat slower. The sympathetic nervous system slows digestion down. The parasympathetic nervous system speeds it up. The two systems tend to complement each other. And this is why I always depict them in the caduceus. We say that the one is the sympathetic nerves, and the other snake is the parasympathetic nerves. And they balance each other. And so long as they are balanced, then we have a good central nervous system between them. See? There's the central nervous system between them. Nicely balanced consciousness. It's when they are completely out of balance that we have disorders. When the intestinal tract is so hyperactive, it's hurrying, we have diarrhea, we have belly aches, and goodness knows what. The two systems are out of coordination. Parasympathetic is rushing the material through. Perhaps there's an infection there, and the body wants to get rid of the material out of the canal as quickly as possible. Parasympathetic is trying to do it, and the sympathetic cannot balance it. So we talk about the sympathetic nervous systems as being quite distinct from the central nervous system. And in fact, we find that the sympathetic nervous system is based on a whole line of ganglia, sympathetic ganglia, which form a cord on either side of the spine. A cord is linked, the ganglia are linked to each other, and they also have nerve processes that go into the spine. And that's what we call the sympathetic nervous system. The highest three of these supply a variety of organs, but they tend to send nerves into the skull along the internal carotid artery. And so many of the organs in the head are activated by the sympathetic nervous system. For instance, the eyes. The eyes are constricted, the pupils are constricted, or they're dilated, constricted by the sympathetic nervous system, dilated by the parasympathetic nervous system. So this nervous system performs actions, activities, which are of a great help to us. We learn to combat it in esoteric training. Now, we could, if you like, for the purposes of illustration here, put some of the some of the organs in that are supplied by the sympathetic nervous system. Some structures in the eye, like the pupil. We could say that, put down eye. We could also say that the salivary glands, the glands that produce saliva, parotid gland, submaxillary gland, these are innervated by the sympathetic nervous system. Then there are the tubes in the lungs. The tubes in the lungs are activated by the sympathetic nervous system. These tubes are called the bronchi, the bronchial tubes, and they are dilated by sympathetic action and constricted by parasympathetic action. So a person with asthma tends to do better when the sympathetic nervous system is working. The bronchial tubes are more or less dilated, and sympathomimetic drugs are used by such people to dilate their bronchial tubes. And so we could go right down here and we could say the lungs are reached, the heart is reached. We've dealt with that. The heart is made to go more rapidly. Yesterday we considered the sympathetic and parasympathetic nerves to the stomach and how it causes motility. I'll just read the others out. You can look them up in any book. The liver, the bile duct, the pancreas, the adrenal medulla, the kidney, the intestines, the uterus, the bladder, and the generative organs. So they all have their sympathetic supply. Now what about the parasympathetic nervous system? This is mainly centered around the vagus nerve. The vagus nerve is the most sacred part of the human body. I'll choose a different color for this. Now the parasympathetic nerves come out of what we call cranial nerves, and they come straight out of the brain. And there are several that come out of the cranial nerves higher than the 10th. But the 10th cranial nerve, which comes from the medulla, is the vagus nerve. The vagus nerve supplies all the structures that I've just mentioned to you. The vagus nerve supplies a branch to the larynx and is important in esoteric matters in that respect. The use of mantras can stimulate the vagus nerve. The vagus nerve sends a branch to the tip of the nose, and meditation on the tip of the nose can stimulate the vagus nerve. The vagus nerve sends branches to structures, or the parasympathetic to structures in the eye, and pressure on the eyeball can stimulate the vagus nerve. The vagus nerve sends branches to the roots of the lungs, and when we expand the lungs tremendously, the vagus nerve is stimulated and it immediately slows the heart down. The vagus nerve supplies two large branches to the stomach and causes increase in secretion of acid in the stomach. The vagus nerve supplies a branch to the pancreas, and it causes stimulation of the secretion of insulin into the blood, which regulates the level of blood sugar. It gives branches to the kidney, to the intestines, and so on. Then right at the base of the spine, there's an outflow of parasympathetic fibers which go to the organs of reproduction, And in this sacral outflow of the parasympathetic nervous system comes many of the problems of discipleship. And whilst the parasympathetic nervous system is stimulated by the action of going to sleep, and in fact when man is asleep, he is capable of extrasensory perception. The physical body is asleep, the parasympathetic nervous system is highly active, and man, if he was conscious while his body was asleep, man is in a state of extrasensory perception. The ability is there. But it has its problems too, and the problem is that the sexual organs are stimulated, especially in men, the moment they go to sleep, and the parasympathetic nervous system affects the sex organs tremendously, and the two features go together: sexual arousal and, of course, psychic capacities whilst the physical body is asleep. The subject of the vagus nerve has been dealt somewhat in my books. It is the most sacred tissue in the body. It is said to be made up of elementals which are evolving, and the comparison with the solar system is the sacred planets. The sacred planets of the solar system are said to correspond to the sacred tissue of the vagus nerve in man. I always look on this nerve as being a sort of lightning conductor. Just as a lightning conductor can pick up a flash of lightning on a rooftop and conduct that lightning right down into the ground, into the earth, so the vagus nerve can pick up from spiritual, mental, astral, and etheric levels Bohat, solar fire. Solar fire can be flashed into the individual, but it is the vagus nerve that carries the solar fire right into the substance of the body, into the substance of the cells. The vagus nerve will carry solar fire into all the organs that I've mentioned. We should remember also that many of the organs that are wet surfaces. Earth, air, and water meet, magic is performed. Where there are wet surfaces on the body, there is interaction with prana, the great wet surface of the lungs. Huge area where countless millions of vitality globules enter into association with the stream of blood passing through the lungs and enter into the nadis and the chakras of the body. Other wet surfaces, the intestine, huge wet surface. We talked last night about the yogis performing dhoti, where they pass bandages down into the intestine and literally scrape the surface of the intestine, not clean but raw almost. Remove the surface epithelia from all the villous processes. And the purpose is to absorb prana from food which is being passed through the canal. Not just the amino acids that we talked about and the fatty acids and the glucose, but the prana from the food. And so man possesses huge mechanisms in his digestive tract and his lungs for the absorption of prana. We should remember that all the time, that we're not just a physical body dependent on metabolic energy. We're also etheric bodies which supply the physical structures with prana. Now we all know that man has grown up in a magnetic field of the earth. And it's, I think, rather significant that the satellite that orbited Jupiter reported a very strong magnetic field in the region of Jupiter, strong enough to be measured anyway. And it's interesting that of all the planets which the wisdom of the ages claims to be populated by humans as close to those on Earth as possible, is Jupiter. There is no claim in ancient wisdom that Venus is inhabited by humans like us. Humans of a high order in etheric bodies, I've certainly seen evidence proclaimed about that. But Jupiter, there are categoric statements that Jupiter is not as far advanced as we are, that the planet is not as dense as ours is, and that therefore the inhabitants of Jupiter are, I believe, in their third round and much, much more ephemeral than we are, lighter in structure and so on. But it's interesting that the Earth and Jupiter have got measurable magnetic fields, and this is where we say life exists in the sort of form that we know it here on Earth. So we've grown up in a fluctuating magnetic field. It's made to fluctuate by magnetic emissions from the surface of the sun. When you take any magnet and intrude another magnetic field into it, you will cause a fluctuation of the field that's been intruded into. And our Earth has fluctuations in its field. Now, man himself lives in this magnetic field, and he has an aura that is magnetic. The aura of man is a definite, fluctuating magnetic field, and it has grown up in the Earth's magnetic field. The magnetic field of man is a definite entity. It has its north pole centered in the third ventricle of the brain, the dilatation of the canal in the brain, and its south pole is related to the base of the spine chakra, the base of the spine chakra. And so this is the magnetic field of man. Now, many scientific tests have been done on strong magnetic fields, stronger than the Earth, the effect of them on animals. My own work has been in this sphere, and also the effect of a negative magnetic field, less than the Earth's. And the negative or less than the Earth field has also affected animals. We have information that the offspring of animals raised in a negative magnetic field have been weak, have not been able to reproduce. There is exciting new information in the book that we have at the back of the room on the effect of magnetism on animals and on the human body, and I have brought some material from my friend Dr. Brownlee in Canada, which will supplement some of the information that I myself have discovered. We find, for instance, that you can put a powerful magnet in a chicken coop where little chicks are being raised, and they will tend to huddle between the poles of the magnet. If the magnet is curved, they will tend to huddle between the two and then move away from this position after about 3 or 4 minutes, and then go back again and huddle there and seem to get something from the magnetic field, even though there is no device near them or on them for them to detect the presence of the magnetic field. Yet they know something about it, that there is something to be derived from it. Now, we must understand what a bar magnet is, and the first thing that you should know about a bar magnet is that the way to locate its north and south pole. The north pole of a magnet will always face south if it is suspended from a string, and the south pole of the magnet will always point north if it is suspended from a string. And so we can very easily locate the north and south pole of a magnet. Once you know the north pole and the south pole of the magnet, by that I'm sure you understood what I meant, that all of you know where the north is on the planet. If you suspend a bar magnet on a piece of string, the south pole will point to the north of the planet. All right? So you can immediately mark your magnet accordingly. You must be absolutely sure that you've got it right, that you have the north pole correct and the south pole correctly marked, because the application of the bar magnet to tissue has very, very different effects, north pole applied or south pole applied. And I'm going to list a lot of those effects tonight, and many of you will never have heard anything about this before and will be astounded as to what these effects are. Now, when you apply the south pole of a magnet, to chicks, day-old chicks, 3 days old, and so on, when you apply the south pole, all sorts of things happen to the chicks. The chicks tend, when they have the south pole applied to them, to grow much faster than chicks who have the north pole applied to them. Chicks grow faster when the south pole is applied. They eat much more than chicks who have the north pole applied. But they also have some alarming habits. They tend towards cannibalism. They peck each other and are cannibalistic. They're much bolder than the other chicks. They're duller in thinking, and they're dirtier in their habits. So that's the effect of the South Pole on young chicks. I'll say it again. They grow faster. In other words, they mature physically more quickly. They eat more. They tend to cannibalism. They're bolder. They're dull thinking, and they're dirty. Now, what happens when you apply the North Pole to the chicks? North Pole chicks are much lighter in their eating habits. They're very much more finicky. They don't eat as much food. They develop much slower than chicks exposed to the South Pole. Their maturation is much slower. And they're very, very nervous, sensitive, and highly intelligent compared to the South Pole chicks. Any noises going on, any flashing of lights going on, they react excessively to any sort of changes in the environment. Heat, cold, wind, sun, weather. And the strange thing about them is that they are immaculately clean, immaculately clean. Now, many things must be derived from you here, by you, about this information that is being given. You must come to your own conclusions. My own experiments were with variable magnetic fields, oscillating north-south, north-south, on chicks, and these chicks tended, exposed to magnetic fields, to grow very rapidly. They had no dirty habits, but they grew very rapidly and were mature much before normal chicks. Now let's talk about the effects of magnetic fields on mice. We're talking about magnetic fields of about 2,500 Gauss, the strength of the field. When you apply the South Pole to mice, baby mice developed much more quickly, just like the chicks. They were born more easily, assisted childbirth in mice. The babies were much larger than than mice exposed to North Pole. Pregnant mothers exposed to North Pole produced smaller babies than those exposed to the South Pole. South Pole produced stronger mothers. They had less effort in delivering their babies than those exposed to the North Pole. On the other hand, mice exposed to the North Pole were very neat housekeepers, incessantly washing and grooming themselves. They were immaculate. They were fearful of noises and lights in the laboratory. On the other hand, the South Pole individuals were always dirty and stained all over, couldn't care less about cleaning themselves. They were bold and strong and less fearful. Then there is the aspect of sexuality with regard to magnets. Paracelsus, the Prince of Physicians, used magnetism frequently to strengthen ligaments which were weakened by childbirth, prolapsing of various organs like the uterus, the cervix, and so on. Paracelsus used magnets to assist in tightening of ligaments. I mention that because now I'm going to talk about the South Pole's effects on sexuality in mice. It had the effect of increasing the sexuality of the mice. I want you to notice something. I deliberately didn't say anything about it because I thought that you should pick it up on your own. Remember that man has a diaphragm. The diaphragm separates the man above the diaphragm from the man below the diaphragm. We're talking in terms of chakras. We all know that chakras above the diaphragm should receive our attention, and chakras below the diaphragm should have our attention withdrawn from them in spiritual unfoldment. We're talking about below the diaphragm, which is a South Pole dominated area, and the North Pole dominated area. Should be picking this up. There are esoteric aspects of magnetism accompanying all physical ones, naturally so. For the aura of man is magnetic. The astral, the mental, the etheric aura is magnetic. South Pole exposed mice, excessive sexuality, often killing the female in their efforts, viciousness, overdevelopment of their sex organs, extremely fertile animals. And this sexual obsession of them tended to shorten their lives. Exposure to South Poles. North Pole exposure reduced all the above factors that I've mentioned with regard to sexuality. Sex organs were diminutive, less fertility, they were not vicious in their sexual activities, and so on. So there is this aspect of sexuality, the aura. Do you remember the parasympathetic nervous system, especially the vagus nerve, which has a flow from above the diaphragm and a flow from below the diaphragm, and is related to psychic faculties. Some more information. When they grafted cancer onto these animals, they first exposed them to the North Pole, and where animals had cancers grafted onto them and were exposed to the North Pole, the cancers didn't take easily at all, would not remain, would not grow. The opposite was the case with regard to the South Pole. Now, research may reveal what I believe to be absolutely true, that North Pole irradiation of a cancer tends to confine it, and tends to act against it metastasizing, little pieces of it breaking away and moving to other parts of the body. I'll say it again. North Pole tended to stop cancers from being grafted successfully onto animals, tend to confine them, whereas the South Pole seemed to have practically no effect, and if anything, a deleterious effect from the point of view of the patient himself. Now here are some of the effects of bar magnets on humans, known to affect cataracts and glaucoma. Cataracts and glaucoma. This is the use of a bar magnet, and as far as I can tell, this is not my particular field, this one, it's the North Pole. But you can get that from the book. I have just put down here that there are effects of bar magnets, and the book would tell you. That's the book that I'm referring to at the back of the room. Anyway, cataracts and glaucoma. We'll be coming back again to this later on. Red cells are affected. We found in England that red cell production was stimulated by alternating magnetic fields, north-south, north-south, and the count went up, the hemoglobin carriage went up. So this would be important in correlating it to anemia. You remember I said a little earlier that sickle-celled red cells, sickle anemia red cells, tended to line up because they were misshapen. They line up north-south, north-south, north-south in a magnetic field. As you know, the red cells contain a lot of iron, and science has long denied that red cells are affected by magnetic fields. In fact, if you look at abnormal red cells, like those ones I've described there from a sickle cell anemia, they are shown lining up north-south. I've got a picture of that in my book, Esoteric Healing. Cataracts, glaucoma, red cell increase. In arthritis, the effect of applying magnetic fields of any kind is to cause the cells to form chains north-south, north-south, and these tend to enable red cells to be drawn through capillaries, where they normally would not be able to pass through. So circulation in arthritic joints is improved by the application, at least of alternating magnetic fields. We'll talk about bars in this respect later on. My own experience is that alternating magnetic fields can reduce blood pressure, and in instances where the blood pressure is normally very low, it can tend to raise blood pressure. It has a regulating effect on blood pressure. It's also been found that in the sprouting of grain seeds, that there's a 10% better yield when seeds are exposed to magnetic fields before they are planted. There's a 10% better yield from such seeds. I don't know. You'll have to look it up. I jotted a lot of this material down very quickly to give it to you. Pain control. I'm not going to describe how its action operates, but in the book you will see that the effect of placing a north pole of a magnet tends to affect the potential difference in the cells of the nerves that I described a little earlier to you. There's electrical activity in the nerve pathways, and the North Pole reduces the potential difference between, sorry, I've just got to say it, between the sodium ions and the potassium ions. The potassium ions are inside the nerve cell, the sodium ions are on the outside. Where there is an electrical potential, this produces an electric current, as it were, which produces the pain. Now, when the bar magnet North Pole is laid next to the nerve, it tends to reduce the flow of electrical impulses from a damaged area and reduces the pain. You find that on page 89 of the book. And the book, of course, is this one here, Magnetism, Its Effects on the Living System, by Albert Roy Davis and Walter C. Rawls Jr. We applied in England magnetic fields in the condition known as shingles. Now, shingles is a virus condition which follows the course of a nerve. And if you have a nerve in the body supplying an area of the skin of the abdomen, that area there, right round to the back, then you'll get the virus attacking the nerve and a whole horrible breaking of the skin, an infection of the skin which is extremely painful. We found that applying magnetic fields to this area under cotton, the magnetic fields are placed on cotton wool and applied to the area. They were pulsating fields, alternating fields, took away many of the nasty effects of shingles, especially the pain. We had many wonderful testimonies about the effect of magnetism in that respect. You will often be presented with subjects, people who have got post-shingles pain that comes after the shingles has healed. My own work substantiated the finding that cholesterol can be lowered, the level of cholesterol can be lowered in the blood, averaging about 20% to 30%. We found also that the sedimentation rate of the blood was reduced in arthritics, and this heralded the remission of the condition. We found that if you magnetized a person, their blood and the rate at which the red cells would settle, we described this on the first night, was affected by magnets. Medicine, orthodox medicine, usually takes the fact that the cells will settle quickly as being an index to the improving of the condition in arthritis. This occurred in magnetism, and indeed we had very good results treating arthritis. Acne, the use of magnets in acne. We'll be talking about infection specifically with bar magnets later on. My own work was to use a solution of usol, solution of lime, which was placed on cotton wool on the pimples, and the magnetic fields were applied, alternating fields were applied for a period of about 20 minutes or half an hour each day. And this had the effect of curing the pimples, the acne, very, very rapidly. We also found that alternating fields assisted in closing wounds, and I'll be coming back to this with regard to bar magnets later on. Closing of wounds, especially wounds, clefts at the base of the spine, near a pilonidal sinus that might have been cut out. We talked about that the first night, that there's a region at the base of the spine which is extremely hard to keep clean, especially for people who do hard work, laborers, people who sweat a lot, and it's an area that lies at the base of the spine between the buttocks. It's an area that accumulates a lot of dead cells, hairs that fall from the head, and sweat material accumulates there, and if that part is not properly cleaned, washed and dried, then you can get all sorts of infections there, and sinuses forming, and if they are cut out, quite often a wound there is very difficult to heal because of the poor blood supply. So some forms of wound healing, quite often the worst place to heal a wound is in a hospital, where all sorts of germs run around fairly freely. And indeed, in England, I had a doctor come to me for assistance in healing because of the difficulty in getting his wound to heal in hospital. Now, I'm going to talk a little further on this subject and give you some more information from the research work done by my friend Dr. Brownlee in Oshawa, Canada. Now, I'm talking specifically about North Pole energies, and if possible, using a very powerful magnet, as much as 3,500 Gauss. North Pole, where you get bleeding of wounds or cuts or tissue damage, the North Pole should be applied. Cuts, wounds, tissue damage. 45 minutes to 1 hour exposure to the North Pole of the magnet results in control of the bleeding from the capillaries. It speeded up coagulation of the blood, the North Pole did, and helped to coagulate in blood vessels that had been severed, capillaries that had been severed. Then there is the subject of burns. We're talking about North Poles again. The effect of the North Pole is a sedative effect. Sedative effect on the person, calming them down, and the pain is greatly controlled and even fully arrested. The pain of burns is fully arrested by exposure to the North Pole of the bar magnet. Again, the amount of time depends on the case in question. It also assists in the formation of a scab over the burn, and also fast overall healing. It tends to cause less fluid to collect where there's a burn, and therefore less chance of the fluid being infected. Then we come to the effect of the North Pole on acidity in the body. Now, I've given you some examples of where excessive acidity can be deleterious, especially in the region of the stomach. Gastric mucosa ulcerates because of excessive acidity. And the North Pole has a tendency towards neutralizing acids. Then we come to the subject of calcium and cholesterol. Remember the first night I talked about a condition, a sign of a condition known as intermittent claudication, where you have blood vessels which are narrowed. You get difficulty in feeding oxygen, say, to the limb or the leg. There's the great femoral artery supplying the leg with blood, and if as a result of calcium or cholesterol plaques the artery is partly closed up, then the person cannot walk very far without getting a pain in his leg, and he has to rest for a while, gather more oxygen, and then he can go on walking. By applying the North Pole of the bar magnet as closely as possible to the site of the difficulty, and they may even know where it is from an X-ray, this tends to do two things. This confirms my work. In fact, Brownlee quotes my book in this respect. It tends to remove cholesterol from the walls of the arteries, and it tends to cause calcium, which has helped to form the blockage, to be dissolved. And I have noted with alternating fields that early dementia, the onset of we say arteriosclerosis, narrowing of arteries to the brain and to the eyes and to the ears, can be offset by placing the head region in pulsating magnetic fields. And so there are these factors. Any form of nerve pain, the North Pole energy can help it, arresting all forms of pain if you give them proper exposure to the field and time. Also, the North Pole has an effect on certain types of infection and the way in which they form pus. The nerve pain of infections and swellings is reduced my own experience is that pulsating, alternating fields can reduce swellings, reduce the amount of water in a knee joint, and so on. Right? Now we consider the effect of the South Pole. The effect of the North Pole tends to produce a constriction of the blood vessels. Yes, I said north. I'm reminding you that the North Pole tended to constrict the severed ends of blood vessels. Now the South Pole has the opposite effect, and there is vasodilatation of blood vessels. It tends to stimulate them to, if you like, relax. It's a sort of parasympathetic action here to cause dilatation of the blood vessels with an easier flow of blood. The South Pole tends to make things more acid. Some people suffer from alkaline bladders. Sometimes you can pick up infections of the bladder when you change your diet to vegetarian or fruit diet. You suddenly find that you've got pains in the bladder because the pH of the bladder has changed. The organisms that were happily there when the urine was very acid are now gone, and they have been replaced by other organisms because your urine is now alkaline. And the effect of a bar magnet South Pole is to tend to make things more acid. Never use the South Pole energy near an infection. Never use it near an infection. I'm going to read the paragraph of this paper to you. Brownlee says that since the South Pole positive energy cannot distinguish between life forms, you should be careful about applying it to regions where there are bacteria. The South Pole will tend to stimulate all life forms, not only the life of the cells, but the growth and multiplication of the bacteria. So keep the South Pole of the magnet away always from infections. Use the North Pole. The South Pole has an anti-alkaline effect, as I said a little earlier, or makes things more acid. The South Pole tends to increase the amount of protein in the blood, increase the amounts of albumin and globulin. Now this can have an application where people suffer from retention of fluids in the ankle, for instance. Wherever there is kwashiorkor. Kwashiorkor is a disease that babies suffer from when they're taken away from the breast of the mother. They're deprived, this is in regions where they're not fed properly. The child is suddenly deprived of the proteins of its mother, and not being given sufficient proteins in its food, it suffers from kwashiorkor. Large amounts of fluid in the belly becomes swollen. The fluids cannot be drained away because there's insufficient protein in the blood. And so we find that the South Pole can increase the amount of protein. Generally speaking, the South Pole has an effect of improving circulation. It must not be used in infection. It tends to relax all tubes, tends to relax the walls of arteries, especially where they become rigid with arteriosclerosis. Takes the cholesterol out of them. South Pole is excellent for that. Brownlee has found that it is the South Pole energies which tend to increase the production of red cells. The lack of red cells or diminishment of red cells is a factor, of course, in anemia. He has found that the South Pole tends to increase the speed and the efficiency of the digestion. So there's a possibility where you have a slack colon, a spastic colon, where there is slow digestion, perhaps constipation, that the South Pole will produce increased motility. So I have given you quite a range of magnetic effects. The bar magnet can be used in conjunction with pulsating fields as well. We use this effectively in England. Just needs a little common sense and application, and you can see many ways where the bar magnet can be applied. A good instance of this is to apply a bar magnet, for instance, to the ear. If that's the external auditory meatus of the ear, here is the eardrum, then a bar magnet can be slid down the aperture, and if the ear is infected, of course, you use the south pole, and also to improve the circulation of blood to the ear, which is often a cause of deafness and old age, then you could slide the bar magnet south pole in like that, south pole, north pole, and the whole region of the ear is irradiated with what? Oh, I'm sorry, the North Pole. I'm awfully sorry. North Pole. If it is the south, if there is poor circulation of the ear, I should say, then use the South Pole. Poor circulation will be increased, but not if there's an infection. If there's an infection, use the North Pole. All right? That sorts that out. So, now you... Yes, the North Pole would be more suitable for a nerve conduction deafness, and don't go and push the bar magnet into the patient's eardrum, perforating it. Usually a person who has ear conditions know just how far they can push something into the ear, and let them put it in as far as they comfortably can. What we used to do in England was to apply the magnet, the bar magnet in that way, and then we used to put the whole head in a magnetic field. We had a box-like structure which was round with wire to make an air cord solenoid. The patient would lie with the head in the magnetic field. It was a pulsating magnetic field. We could make it pulsate at a number of cycles, from 20 cycles up to 800 or even 1,000, and then put the bar magnets in. And they would have this effect of the North Pole, but the North Pole would come and go. If you understand what I mean.
You usually put them in both ears regardless?
No, you put it in one ear if necessary. I'm about to talk about what you do when you put them in both ears. If you want to reach a structure in the middle of the head or in the middle of the brain, then you put in two North Poles like that, and the North Pole will repel the other North Pole. And so you get a flux of energy in the middle of the head, like that. Two magnets are repelling each other, and the field is applied more or less to the central median structures, pituitary gland, pineal gland, any medial structures. Then if you want to, you can reverse this, and you can have a south pole here, and of course your magnetic field moves across, right across here, and you have a north pole and a south pole here, and a resulting magnetic field here. Put it in an air cord solenoid, and you have a fluctuating field going right through the head structures.